Inequalities in Healthcare, A Grave Injustice by Group 17. Racism and inequality in the United States operate at a systemic level, placing minority groups at a significant disadvantage, including people of color, women, and the LGBT community. For centuries, majority groups benefited from the systems that provided them with greater access to money, power, employment, resources, education, and healthcare, while minorities in our country struggle. American Journal of Economics and Society. During the Jim Crow era, structural racism sponsored by the federal and state governments explicitly created advantages for Caucasians and disadvantages for African Americans. Structural racism still exists today. Healthcare inequalities refer to differences in resources and distribution to different population groups that oftentimes causes preventable pain and death for people of different ethnicities and socioeconomic statuses. The system inequities, of course, include health status, but also access to healthcare and the care they do receive once in a doctor's office or hospital. Many minority patients' pain is not taken seriously by doctors and nurses, leaving them to grow sicker or even die. This was especially prevalent during the COVID-19 global pandemic. Primary care development cooperation. Blacks and Hispanics are dying at a drastically higher rate from COVID-19 than their white counterparts, indicating that primary care access is lower in many areas with high COVID-19 rates. Many of the same neighborhoods with high rates of COVID-19 infections and poor primary care access are low-income neighborhoods of color. Another barrier exists because of language, where patients are unable to effectively communicate to a doctor and there are not enough measures taken to ensure they are represented. Thirdly, the cost of healthcare insurance places minority groups and citizens in the lower class at a significant disadvantage, where many are unable to afford healthcare or prolong healthcare services until they are in excruciating pain or too sick to even treat. According to the National Healthcare Quality and Disparities Report of 2021, compared with white groups, the number of measures that were worse exceeded the measures that were better for all racial and ethnic minority groups, except for Asian groups. Many studies prove that biases are evident in healthcare. Studies show that minority groups often suffer because of lack of attention, little to no follow-up appointments or help, and they are not accurately informed of symptoms and consequences of their illnesses.
The effects of health disparity affects all of society in different ways. It can be more internalized in an indirect way or even indirect way that goes unnoticed in our life. Some of the direct problems that groups suffer are life expectancy, mortality, language barrier, and insurance, as well as insufficient funds and discrimination. An indirect reason that impacts all our taxes, believe it or not. With there being great amounts of people suffering because of health disparities, the increase in burden on taxpayers grows, as well as the cost for care. With more people in need, the more taxes go up to try and provide an adequate service. Every person should care about health and equality because no matter what, it affects all, and the only way to solve a problem is by addressing it. Healthcare inequality can impact a diverse amount of people and social groups. Many key factors that come into play are caused by the social environment that they are placed in. Many times these groups suffer poor health because of lack of attention, resources, transportation, as well as discrimination they face in the healthcare world. People of groups of race and ethnicity, economic status, age, gender, and location. Health disparities can be experienced in many forms because of extensive groups it affects. The life expectancy is reduced due to the lack of care in minorities. With mortality, there is a difference between the life expectancy of a white person and those belonging to an ethnic or racial minority group. In a language barrier, many times people stop asking for help due to not being understood because there is not enough representation and help for those that English is not their first language and are many times ignored due to understaffing. With insurance, there are many minority groups suffering because of being uninsured, especially those of color. Of the 30 million uninsured, about half of the people are of color.
Direct service. When people of marginalized communities cannot afford or would be financially ruined by the care they need, social workers can fight for them on a case-by-case basis. Going to the hospital is an ordeal for a well-connected and wealthy individual, let alone someone who is barely scraping by. Social workers are needed to help get people back on their feet. Price of healthcare. The people who would be most affected by a large hospital bill are less likely to negotiate and use every resource possible to pay as little as possible. Direct service social workers can and should advocate for them in this way. A $20,000 bill is much more manageable than an $80,000 bill. These drastic reductions are achievable and life-changing. The first thing a social worker can do to achieve this is ask for an itemized bill. But Liminal reports that 25% of the charges and reviews are not billable. 2. Negotiate with the healthcare provider and hospital. Oftentimes, just talking to someone in an office will result in a smaller charge. 3. Check eligibility for Medicaid/subsidized insurance. In some states, Medicaid is even offered retroactively. Nonprofit hospitals are federally required to provide financial assistance to low-income patients. Social workers can and should do everything they can to get disadvantaged people's medical bills lower. Logistics, post-op care. After a procedure is done, patients are expected to do certain things to avoid complications. Social workers can make sure these things happen, whether it be making it to appointments, taking medications, not putting pressure on a surgery site, or doing regular dressing changes. Beds are scarce, and hospitals are motivated to push patients out, even if they still need a small level of care. If the patient does not have a supportive network, they won't be able to get that when they leave. This contributes to the shortage of beds and leaves healthcare staff doing work they are overqualified for while sicker patients wait in the emergency department. Social workers can make sure that these patients have someone to check on them and provide the basic care that a family member would do.
For policy advocacy, I looked at the Health Equity and Accountability Act. This has been introduced since 2003 and has not passed the Senate since. It addresses social determinants of health and improves access to underserved communities. It also addresses the mental health crisis in America. In the past 2 decades, this has been the only legislation that addresses the crossing of race and ethnicity to the healthcare inequalities. The 10 titles that are labeled to this bill are what follows. Title 1, Data Collection and Reporting. This strengthens the collection of data for historically underrepresented populations. Title 2, Culturally and Linguistically Appropriate Health and Healthcare. This ensures culturally and linguistically appropriate health and healthcare to reduce disparities in health for non-English speakers. Title 3, Health Workforce Diversity. This improves health workforce diversity to make sure that patients are represented by the providers. Title 4, Improving Healthcare and Access Quality. This addresses systemic barriers to quality care for vulnerable populations by expanding coverage, improving access to healthcare facilities, innovating in care delivery, and creating health empowerment zones. Title 5, Improving Health Outcomes for Women, Children, and Families. Title 6, Mental Health and Substance Use Disorders. This improves the availability and accessibility and quality of mental health services through increased funding and development to combat inequalities. Title 7, Addressing High-Impact Minority Diseases. Title 8, Health Information Technology. This promotes, strengthens, and invests in the health IT infrastructure to multiply its impact on racial and ethnic minority communities. Title 9, Accountability and Evaluation. This emphasizes the federal government's responsibility to prevent healthcare services discrimination and the importance of strengthening accountability through transparency and enforcement actions. Lastly, Title 10 addresses the social determinants and improving environmental justice. This defines social justice determinants of health and introduces assessments and programs to remediate the factors influencing the unequal distribution of health inequalities. Community organization and direct action. The language of health equity to call for change allows for the direct address of health needs for social groups that are disadvantaged. This is helpful because addressing health concerns can be more attractive to lawmakers and other decision makers than direct calls. The hashtag #ForAll campaign was an effort to bring state-financed health insurance to undocumented immigrants. They sought to address the denial of federally supported coverage of this set of immigrants in the Affordable Care Act. In 2013, advocates and groups conducted campaigns that consisted of public hearings, lobbying officials, mobilizations, and rallies. These were efforts to secure health care for undocumented, and they paid off.
A smaller, more localized campaign, hashtag Health for All residents in Fresno, blocked the elimination of some health services for the undocumented. CDC says that communities can promote health equity by adopting policies, programs, and practices that support equitable access to quality and affordable health and other social services and accessibility within these services, recognize, respect, and support the diversity of the community they serve, include community efforts that can help strengthen partnerships, community members, and public health entities, engage trusted leaders known by the community and who are part of the same community to share information, collect input, or conduct outreach. It is our responsibility as citizens and potential future social workers to be active members of our society. This includes fighting against injustices. To help combat the issue of health inequality in the United States, we can donate, volunteer, and educate ourselves and those around us. Health Equity Initiative is a nonprofit organization based in New York that connects people with resources and volunteer opportunities all around the country. They seek to educate the world around them. They hold events that foster community building, education advocacy, and training for individuals and businesses. They also hold seminars and public speakers. They value passion, commitment, teamwork, and integrity in the fight against racial injustice and health disparities. You can also donate or volunteer your time for organizations in Iowa such as United Way. United Way invests in local programs that address challenges in the community such as healthcare disparities. United Way works with essential needs of the community, early childhood success, education success, economic opportunity, and health and well-being. By donating or volunteering, you are creating a difference for those around you. It is also crucial that we stay politically aware and vote for legislators who advocate for healthcare equality and reduce costs of healthcare. Commit to educating yourself and the world around you to make our country safer and healthier for everyone. The inequality in our healthcare system is a collection of blatant violations of the values our nation holds dear. There is hope, however. Significant moves have been made in the right direction. It is our duty to continue the fight with the methods we know are effective: direct service, policy advocacy, and community organizing. Thank you.